All right. Well, hey, everybody, this is Representative Tom Sullivan, House District 37, with our kind of regular Friday video. We're very excited today to introduce from Tri-County Health Department Board Member Kaia Gallagher. Kaia, thanks so much. And you have a staffer here with you. Introduce her for us, please.
Yes, Mellissa Sager from Tri-County Health Department has just been doing a wonderful job of coordinating all of our weekly calls with local officials to update us on COVID.
Great. Hello, Mellissa. And I think we talked one time before. I think when I talked to Dr. Douglas, you were on, helping us through. So thanks again for joining us today. So I wanted to talk about, what today's conversation is going to be is going to be about the COVID virus, where we are as a county with how it's been impacting us, the different ways that we're kind of looking at it. Also, as when we're recording this is the first day that the vaccine has been sent into the state, and everybody's been watching the news, and they're going to be curious as to how that's going to impact them and how that all breaks down. So what do we first kind of wanted to start with, and maybe you guys can help us understand. Right now, Colorado is using a dial framework, color-coded. Is there what 6, 7 different colors that we're using? And maybe if you guys want to describe to us how that works and kind of when it fluctuates and where Arapahoe County is right now here as we enter in during this holiday season.
Yes. Kaia, you want me to go over the dial and then I'll kick it to you for Arapahoe County?
That'd be great.
Perfect. Representative Sullivan, you're absolutely right. CDPHE issued a public health order. It is in the framework of a dial, so it goes from green to purple now, each level representing different restrictions related to reducing the spread of COVID-19. And the idea behind the dial was to give folks some predictability in what's to come, both as things become more restrictive, but also as they become less restrictive. And it ties each of those levels to metrics within the county. Those metrics are a 2-week cumulative incidence rate, so the number of cases we see in the county over a 2-week period. We do 2 weeks because by day, you would get a lot of up and down just because the amount that labs process, the amount of people that went to get tested just that day. And so we do 2 weeks. The other 2 metrics are percent positivity, so the number of cases that are tests that are coming back positive, and then hospitalization, so the number of folks in the hospital. The state did just add an additional level a few weeks ago, level purple, as the new stay at home. The metrics for that level are completely based on hospital capacity. So when we move, if we were to move into a stay at home, it would be because our hospital capacity has been reached. And what that looks like is personal protective equipment, the number of beds, staffing, which we hear a lot from our hospitals. They're good right now, but they're stretching their staff just like we all do. They're rearranging schedules and bringing in temporary employees to meet the need. But if we see cases go up dramatically, then that hospital capacity will be threatened, and that's what a stay at home will be based on. We have a lot of information, and we encourage folks to check out CDPHE to monitor the data and the levels. But with that, Kaia, I'll turn it over to you to talk about Arapahoe County specifically.
Sure, thank you, Mellissa. Well, as Mellissa said, we have a rainbow dial, and unfortunately, Arapahoe County is at the red level now, which is 1 level short of purple. If the metrics are all available on the Tri-County website, and there's also information about the limitations that are associated with each of these levels on the dial. So what being in the red dial means is that for our residents, most indoor activities are either prohibited or strictly limited. there are some outdoor activities that are being encouraged as an alternative. We just all need to stay as safe as we can be.
Great. Now one question in your explanation there on the purple area there. So there is then the possibility that there may be beds or rooms available, but we don't have staff to maintain them. And so that would still create us into the purple phase there. Is that right?
That's exactly right, Representative. We have seen and we monitor the number of folks in the hospital as that metric for levels blue through red. But there is a chance that we have beds, we have ventilators, but we just simply don't have enough staff to monitor those patients.
Okay. Wow. Okay. Great. All right. So thanks for that. So now upcoming holiday season. So what are some of the bottom lines for the holiday season as far as, recommendations, mandates, that kind of stuff where we listen to, it seems like Dr. Fauci is getting himself on TV more, than he did in the last couple of weeks. And so we're hearing more from him. Anything in particular, or you want to go over some of those, what we've got to look forward to for the next, 2 weeks or 3 weeks of holiday season?
I think that's a great point, especially with the holidays coming up. The bottom line is that we are safer when we choose to celebrate the holidays only with people who live in our households. This is difficult for everyone, particularly since the holidays are a time when we all value being able to gather with our family and friends and those who do not live with us. On the Tri-County website, there are a number of alternative ways to celebrate, ways in which the Arapahoe County residents can have virtual celebrations. It's not the same, but we are living at a time when the possibility of becoming infected with COVID is very high.
Great. Okay. So how about we want to limit our sizes. Are there any any specific mandates that have sent out? I mean, do you have specific travel restrictions, or these are just kind of recommendations that we're asking people to follow through on?
So there are restrictions under the statewide public health order on the number of folks that you can gather with. Under level red in Arapahoe County, personal private gatherings are prohibited with anyone outside of your household. These are those small dinners that you have, you're at home with your friends and family. And what we know is that folks are less likely to distance, less likely to wear their masks in that setting. Sometimes it feels rude. I don't want to wear my mask around my aunt and uncle. I'm not going to distance from my little cousins that I'm going to play with. And so we've really strongly urged people not to gather in those personal, private settings with people outside of their household. And then, Kaia, to your earlier point, encouraging alternative things outdoors and virtually. So trying not to focus on what we can't do, but focusing on those innovative, fun things that we can do, just a little different.
Yeah, one of the things that I was thinking of, with Thanksgiving, about people wanting to go, to grandma's or another, sibling of some kind. And I thought, okay, well, you shouldn't take, public transport, you shouldn't fly. But then I thought, well, what if they drove themselves, stayed in their bubble and went there and then came home in their bubble? Was that wrong of me to think that was maybe the appropriate way to do it? Or should the suggestion have been, no, you should have just stayed home and, got on a Zoom call or called them?
There's no mandate that prohibits travel, but it is certainly not recommended. And if people do decide to travel, they should try to minimize their risks in whatever ways they can. So there are some travel restrictions in certain areas. People who travel should consider getting tested before and after they travel. And again, minimize their risk. We've all heard the ways in which we can stay safe. Wear a mask, wash your hands frequently, keep your distance from others. And certainly if you're at risk, I think it's particularly important to try to stay away from as many people who might infect you as possible.
Yeah, and that's, you know, and that kind of leads us to the next part. I mean, we have been in this now 8, 9 months. We've come along, I mean, and, you know, with the introduction of the vaccine, I mean, you know, it's right around the corner. It's coming really, you know, you want to ask everybody to just hang on a little bit more. And if, you know, and to, you know, think about and respect what you've done, these last 8 or 9 months, you know, keeping yourself safe, keeping, you know, your family and your the rest of the people, you know, around you, you know, safe and healthy, you know, as you can be. And certainly there's a mental stress through this, but overall, you know, your physical, health has prevailed. So that's why we want to talk about the vaccines. We've got, you know, a 3-phased vaccine rollout that we've got coming about. It looks like here in Colorado, the Moderna vaccine is going to be the predominant one that we're using, but is that the Pfizer ones are coming to us right now on a smaller level, but the ones that the vast majority of Coloradans are going to get is going to be the Moderna. Am I correct in that?
I am actually, Representative Sullivan, not entirely sure which vaccine we will get more of, but we are seeing this staggered shipping of these vaccines. Some require ultra cold storage, and so getting vaccines, but ensuring that we have a place to store those here in the state of Colorado. And so that will be a factor of which vaccine we get more of. And so it's coming from different places. There are different vaccines, and it'll depend on where we can store them and where they're going elsewhere as they come out.
Oh, okay. Well, the governor came out with, and we've got it on our Facebook page and on our website about the response that's coming out. So the first early phase timeline has it here winter of 2021. They talk about the two different types, the Pfizer and the Moderna that are both coming out. The efficacy rate on those 95%. We can all, you know, marvel, you know, at that and continue to marvel at the quickness in which this has come out. And I just maybe you can speak to that. There's, you know, there has been some concerns about how quickly it has been coming out, but I think some of the advances that we've made and the things that we did at a, you know, where everybody was working together, it didn't look like, I mean, you know, it's hard for people to understand that really the government was working together and, you know, with industry and all of that, with all of the chaos and the division that we see around us. But when it came to this, you know, private industry and the government were really working close together. So, you know, it's not that surprising that we were able to put something like this together in what would be, you know, a short period of time compared to other vaccines.
Yeah, I think it's impressive that the FDA worked very hard to proceed cautiously, to look at all of the early information on the results of the trials. And they will be continuing to monitor the large numbers of people who are now being immunized. I think we can say with confidence that to date, there is little evidence that there is any concerns that people should have about how safe the vaccine is.
Right. Yeah. I mean, again, I just think that we've really worked on it, and you know, people. I mean, again, we've just got to continue to talk about it, and you've seen it today, and you'll continue to see it. You know, each day when each state has their first, you know, person who gets the vaccine, there's going to be a lot of public, you know, vaccinations done, and you'll be able to see, you know, one another on who's getting it done, and those who have completed it, we'll be talking to them and making sure that the rest of the community knows how well we've done. So any conversation on the distribution plan that was introduced by the governor and CDPHE and Tri-County, and how they all work together, on that? Any discussion from either of you pertaining to that?
Well, I think Mellissa has more detail on the activities within Tri-County Health Department, but I'll just say that as you have posted, the first priority will be those most at risk for developing COVID, including frontline healthcare workers and the staff and residents within long-term care facilities and nursing homes. The plan in the spring is to offer the vaccines more broadly to those over 65 and people with comorbid conditions. And by the summer, the general public should be able to have access to the vaccines. Any other details you want to add, Mellissa?
Yeah, I'll just say that the CDC makes initial recommendations. Those come out to the state, and then the state fine tunes those. So Kaia mentioned the high points. There are some other areas like teachers and other congregate care settings, as well as frontline or essential workers that may not be front facing with the public. And so really balancing who needs that vaccine first, frontline healthcare workers being the first, and then working on how that is distributed because there is such a small supply and it's going to come out over time, just prioritizing those. So the state has a lot of great resources. Tri-County has a vaccine page as well, and we'll make sure we get those to post for your constituents representative. And those things are still being fine-tuned. So we expect information to come out from the state this week and in the coming weeks.
Right, absolutely. Yeah, everybody, all that information is going to be out there. I would just tell our constituents, wherever it is that you get your news, it's out there. I mean, our Facebook page, all of the links that we're going to post has it. You don't have to memorize, exactly which phase you're in and where you're going to fit in. It's all going to be there. And like you say, it is being fine tuned, and we'll see if there were problems or people need to be added and that type of stuff. I think that's, a lot of great information. One of the things I was hearing in the discussions today, with any of these, kinds of a virus and stuff, this isn't going to be like a one-time. We're not going to eradicate this once you get your 2 doses and then you're all finished and you don't have to do this again. I mean, with others, like, the polio vaccine, our flu vaccines, all that, we had to do that time after time after time. And that's going to be the case with this as well, right?
As far as I know, yes, that this will be, COVID will be with us for a while. I think there's some concerns about whether COVID will mutate and whether we will face additional pandemics. There are open questions about how long the immunity will last. I've heard questions about whether those who had COVID actually need to be immunized. So there are a lot of unanswered questions at this point.
Right. But I mean, this isn't, this should be, is going to be a part of our regular healthy regimen types of things that we do. We get our flu vaccines on a regular basis. We go to the doctor, we get a regular physical every year. And this is going to be just something else that's going to be added into it. And in a short period of time, it's just going to become more routine. And that just seems to be, the way it's going to be. And we need to really curtail, the tragedy that it's passed, within our communities and all of that kind of stuff since then. Anything else? Anything that I've missed? Anything that you wanted to make sure that the people of HD 37 heard about and Coloradans need to know that maybe we forgot to talk about?
I think this was a great conversation, very important issues that our residents need to know about. We mentioned that the Tri-County Health Department has a lot of information on its website. I would recommend that anyone who has questions go there for more information, but there's also a Tri-County call center. And I'm going to just give you that number, 303-220-9200. So once again, the call center number is 303-220-9200. So if any residents have more specific questions that they need to have answered, that would be the place to go.
Right.
And Representative, I'll just add, keep reaching out, keep looking for new information. Things change frequently. This is new for all of us, and we want to be very responsive to new information that becomes available. So we know a lot of folks get frustrated. This changed yesterday, it's changing again tomorrow, and guess what? It's going to change again next week. And it's really because we're following the data, the science, the feedback from our community, and we're adjusting as we go. So it does change, the rules change, but look for those trusted sources. Tri-County, like Kaia mentioned, the state, your elected officials for connections to resources, but keep reaching out and monitoring for those changes.
Absolutely. Look, good. That's great advice. There's always information out there. It's out there. Contact the people that you you know, have faith in and that you know are around. And again, the information is changing. I'm going to just give them another number if they're watching this program. Our office number is 303-866-5510. Feel free to call us. We'll get back with you, get you the information. Check our website, our Facebook page for all of the different links. And certainly you'll be able to put questions on this link after it plays out, and we'll get back to you as soon as we can with that. Mellissa, Kaia, thank you so much for spending some time with us this afternoon. We really appreciate all that you've been doing, you know, during this, and you know, we're all working together on this, and that's the only way that we can, you know, survive is by all working together. So thanks so much for spending some time with us. Thanks everybody for following along, and we will talk to you again next time. Thanks.
Thank you.
Thank you.